So what the PPL does, we help people and government build better lives. Well, that sounds nice. What that actually means is that we are nonprofit and nonpartisan. We work in the public interest. We partner always with government. Some of our projects are also with large philanthropies who are looking for strategic design assistance, but our primary focus is on working with government agencies. And that's typically municipal agencies here in New York City, also on the federal level, also some municipal agencies outside of New York. We help those agencies design policies and design services. And I'll tell you a lot more about that when we get into some of the case studies. But if you think about what government does as being a kind of continuum that runs from policy making on one hand, somebody deciding that, for example, there should be a wall between the United States and Mexico, and then someone else actually has to figure out what's the legislation and regulation that would make that legal, and then someone else has to figure out how do you actually build that thing and maintain it. So you can think about policymaking being the sort of original decision-making process flowing down into a set of sort of regulatory and operational decisions. And then you can think about service delivery being like what actually happens once the thing exists on the ground. So we help our partners at both ends of that process. And sometimes when we're lucky, we get to do the whole thing with them, although that's harder for various reasons. And our focus is always on services and policies that affect at-risk and low-income populations. This is not to say that we would not do something around banking regulation, but it's not our focus. Our focus has been specifically on marginalized communities. So the big problem, of course, is that there are policymakers who are, in my experience, smart and well-meaning people trying to do useful stuff in the world. And then there's the rest of us who are living with the effects of the policies that they make. And there seems to often be this kind of gap between what policymakers intend and what the lived experience is of people who are actually dealing with the service. This is particularly true the more the service is intended specifically to affect the lives of low-income and marginalized people. The more you are dealing with a service that is created primarily by educated upper-income people with power, and it affects lower-income people with less access to education and less power, the more likely there is to be this divergence between the intended experience of the policy and what actually happens on the ground. So we can think about why is that? I mean, policymakers are operating from a certain frame. And that frame is one where, first of all, they have power. They have legal power. They have finances, financial resources available to them. They have a kind of public position of authority. I think that they're also, in many ways, policymakers are utopian. Like the whole act of designing policy in a democratic society where you say, we're going to try to make a thing that's good for people. I mean, you don't hear a lot of policymakers say, we're going to try to make something that's really awful and where everyone's really going to hate it. There's generally a pretty utopian viewpoint that we can make a thing that improves people's lives, and we are going to, and in fact, we have. There's a strong commitment there to the idea of doing and being good. In the act of doing that, policymakers like to think of themselves as rational and reasonable, and that they're making decisions about how their public authority and their public resources are going to be dispersed in a way that's sensible and defensible. That they're not just saying, oh, I'm actually going to do this program because it's going to benefit my cousin over here. They're saying, no, I'm doing this thing because it's for the good of the whole population. And also, policymakers have a real focus, sensibly on what it's going to take to actually operationalize a thing. What are they going to have to actually do to make it so the thing actually occurs in the world? Meanwhile, on the other hand, you've got all of us walking around, not thinking most of the time a lot about the policymaking processes that are affecting our daily lives, relatively disempowered and often pretty disengaged from what the sort of process of civic making is. I mean, hopefully everyone in this room votes, but even that, 50% of Americans don't do. And even if you do vote, How much do you feel that your act of voting, say, is a really meaningful act of civic participation? Are you attending your community board meetings? Are you writing to your legislators? Are you participating as an advocate who is seeking to create certain kinds of social change? You know, meanwhile, a lot of us just need to like go to our jobs and go home and make dinner. So it's hard to be fully engaged in the process of policymaking or civic making when you are not, in fact, you know, tasked with doing that as part of your job. So I would say we're relatively disempowered. We're also fundamentally pragmatic, most of us. We're just trying to think about how to live our lives. We're not thinking, and specifically our lives and the lives of our family. It's hard to take responsibility for living your own good and reasonable life while also trying to figure out how to solve everybody else's problems. So primarily we are, as citizens, focused on our own lived experience. We're also super cognitively loaded. We've got a lot of stuff going on. So like thinking about some policy decision, I mean, I don't know how much time all of you are spending right now thinking about the tax bill. I mean, I'm thinking about the tax bill a little because I'm reading my Times, but I'm not thinking about the tax bill 24 hours a day. You know, like I've got other things on my mind besides the tax bill. So like I'm sure that you probably share a commitment to other things besides thinking about policy. And in fact, some of those things actually may be really pressing. And the more likely you are to be low income, the higher that cognitive load is. Because one thing about being poor is that it's hard. It's harder to be poor than it is to be rich. Because you don't have money to grease things and smooth things and make it easier. So think about the fact that if you think about how somebody is navigating their sort of civic life, the poorer you are, the more likely you are to not actually be able to engage in it in a substantive way because you've got a whole bunch of other problems like how are you keeping the heat on. Finally, those of us who are not thinking as policymakers are in fact walking around in our bodies. And our bodies are affecting how we are feeling. You know, I'm sick, I'm not sick. I'm able-bodied, I have a disability. I'm a white person, I'm not a white person. All of those things are affecting how it is that our bodies move through our civic space. And how we feel when we are interacting with the kind of organs and agents of our government. And those are things that are very specific to each one of us in our lived experience. Those biological components of our civic life are not necessarily front of mind for policymakers when they're in the midst of doing this utopian and rational policymaking process. So, what does design have to do with this? There's a fancy build on this slide that I forgot about. Design brings primary research, thick data, shared stakeholder needs, materiality, iteration, all of these ways of engaging with this kind of biological, lived, conflicted experience that all of us have. Policymakers, on the other hand, are bringing theory, surveys, these operational requirements, a commitment to equity in the sense of all citizens having equal access to public goods. They're bringing politics, which is an awareness of risk and desirability. Neither of those things are wrong. Both of them are super valuable. And what we actually want to be doing is making our policy and service delivery decisions at the point of intersection of both of those things. So how do we do this? So this is a phase diagram. You've perhaps heard from other people who professionally design things, and they will have shown you something else like this from their work. It says essentially that we try to figure out what's going on in a discovery phase. Then we actually try to make some stuff that has to do with what we think is going on. And then we try to decide whether the thing that we made, because of what we thought was going on, actually had any impact in the world. Now, what that actually comes down to, really though, is the same thing repeated over and over again across phases. One, trying to get the people who have power to believe in the process that we are doing hands-on work with the people who are actually living the experience of the policy, then doing a professional process of refinement and improvement going through the cycle of 2 and 3 multiple times, as often as we can, given the timeline and the budget. And then finally, when it's done, it's not done, because you actually have to sell the work. You have to actually get the people, again, from item 1 there, to believe that the thing that you've designed for them is something that they actually care about and that they intend to implement in the world. So there's a strong, your partners may be willing to engage you to do the work, but you don't really know until the end whether they're going to be willing to use what it is that you've designed for them. No matter how good of a designer you are, there is still going to be a question of uptake. So another way of thinking about this is not just how do we design, but how do we design systems of power that serve people who don't have power. So I'm going to take you through some examples of projects that we've done, and I'll talk a little bit about both the mechanism of the design process and this question of how did we seek to serve the needs of a disadvantaged population in each case. So here's an example of a project where we worked with a disadvantaged population. People incarcerated in Louisville, Kentucky for various offenses related to their addiction to opioids. And the question there actually, which was posed to us by the city of Louisville, was, hey, we've got this jail and it's super overcrowded. And it's overcrowded because we have this huge influx of people who are using opioids and are getting arrested for stuff related to their opioid use. So what do we do about that thing? So it was one of those great briefs, which is both specific and yet almost endless. Because really the question there is, you could start back at why might someone want to use opioids as a reasonable design research question, down to the specifics of what is the nature of the interaction between the corrections staff in the jail facility and the people who are incarcerated there. And in fact, we asked all of those questions. I'll say a couple of things about process. I'm going to try to do a little process and a little policy for you on each one of these projects. A thing here about process that was super interesting was the degree to which, although we were, everybody on this project had been working professionally as designers and researchers for many years, the degree to which our own processes around consent were profoundly inadequate to a circumstance where we were dealing with incarcerated people. Does that even make sense, that statement to you? Do you know what I'm talking about when I talk about consent? That like, when you are doing human research, you need to make sure that you're not actually endangering or belittling or exploiting the people who are actually giving you their life material to use. I mean, there's a way in which all design research is fundamentally exploitative, because you are presumably going to get paid to go and ask somebody stuff about their life, which they're probably not going to get paid as much to give you as you're getting paid to extract it from them, and then you're going to turn around and make something of value out of it. So you have to actually be highly conscious of the degree to which you are mining people's actual personal life experience to make value for yourself and your partners or your clients. Now that's, okay-ish when you are very explicit about the fact that that's what's going on and you are trying to compensate people in some way for this valuable thing that they're providing to you. What gets really tricky is when the people whose lives you're interested in are incarcerated against their will. So, did these guys even want to be talking to me? Did they want to tell me about what led them there to jail? They were volunteers, but they were volunteered by corrections officers who had weapons, and they don't. Like, did they get to choose to walk into that room to talk to me or not? So we did not have sufficient protocols in place before we did this project to understand how to deal with that situation, how to deal with a research population who was fundamentally not in control of their body or their story anymore. Happy to talk to you more about how we resolved that problem. The thing about policy here was super interesting. We were, and you will find this if you go into public sector work, that it's not often so clear as you have a partner and that partner has all the authority and they can just make the change that you would recommend that they make. Because in this case, we had multiple partners even on this project, both the mayor's office in the city and the Department of Corrections. And the mayor's office and the Department of Corrections actually don't have the exact same needs and goals. The mayor's office is trying to run the whole city, and the mayor's trying to, make sure that what he does is popular for his constituents. The Department of Corrections, on the other hand, actually has 2,200 people locked up and is trying to figure out how to manage them. So they don't have the same questions, and they don't need the same kinds of answers. But additionally, a lot of stuff that happens in the criminal justice space is actually decided on a state level. It's state legislation that causes people, in many cases, to be incarcerated. So you are designing for, what's a good metaphor here? You're designing not for a stable surface. You're designing for a surface which is like the surface of the ocean. The waves are rolling through it, and those waves are waves of political power, So you are trying to figure out what recommendations do you make, what kinds of insights from design can you provide that are going to be useful for multiple different kinds of stakeholders who have different things that they need out of whatever changes are going to occur. Because what you're trying to do here, of course, is encourage change. I mean, that's what this kind of design research does. It supports innovation, and innovation means change, and change means doing something different. So you have to actually try to enable people to embrace difference. But again, they don't want the same future. So that question of how you design into that space of a contested future is an interesting one. In this particular case, we ended up getting some outcomes which were satisfying in terms of micro-level changes in the jail, where some things that our research had turned up had to do with, for example, people getting incarcerated in, say, the summer months in Kentucky. It's hot. You come into the jail wearing flip-flops and shorts, and being released 6 months later into the middle of winter with the same clothes. And literally like being turned out of the jail into the middle of a snowstorm with no warm clothes and no place to go. So we highlighted some findings like that, which helped the jail think about some different release procedures. So that was a good thing. We also were able to do some recommendations, which I think have been winding their way through city and state policy, looking more at like, how do pharmacies, for example, interact with people who are being turned down for opiate prescriptions, or being told that they can't get a refill on a prescription opiate? Because that's often a point where people begin using street heroin if they can't get an opiate prescription any further. So trying to do some upstream and downstream interventions so that people don't even end up in the jail. Because really, jail is a really stupid place for anybody to be, and it would be better if we didn't have jails, and didn't have people incarcerated in them. So this question of how you actually try to avoid having people end up in the jail in the first place seemed to us to be the most kind of interesting design question. Okay, digital policy. City of New York, more and more, is noticing that people use their phone for things, and perhaps the city might also want to deliver the city's services ever more through digital channels, rather than you having to go to some city office and get a thing. So the chief digital officer for the City of New York had the thought that she wanted to develop a kind of digital playbook, a kind of set of policy guidance directed most specifically at the city's operational agencies, but also a public-facing tool that kind of announced the City of New York's sort of official position on how the city wanted to engage in the process of delivering services through digital channels. So for this work, there was a bunch of research done. There was research that we did with city leadership at both in the mayor's office and also in different agencies, asking people who had control over the making of digital versions of city tools, what do you need? What's the problem? What are your issues? What would support you in delivering really good digital services for the citizens of New York? We also talked to a bunch of civic tech experts, people who work at all kinds of organizations, at startups, and various kinds of digitally oriented advocacy groups, getting information from them on what's really considered best practice around the digital delivery of digital services, of public services. But as you might imagine, those two clusters of humans tended to be people who had college degrees, who spent, had some broadband-enabled device attached to their body or within a foot or two of it pretty much 24 hours a day, who often had multiple digital devices that they used, who were native speakers of English, or at least very fluent speakers of English, who tended to be upper quartile in income. There was a whole set of characteristics that those informants had when they talked to us about the role that they thought digital service delivery should play. So for a further chunk of this research, we specifically tried to think about populations of New Yorkers who would be least likely to be able to successfully access city services through digital channels. So we interviewed residents who had various kinds of visual disabilities, who were blind or partly blind, to talk to them about how use of screen readers and other tools affected their use of services. We spoke with a bunch of folks who were not native speakers of English and who were in many cases not literate in their native tongue. So trying to learn about how low literacy affected use of digital tools. We spoke with a number of people who were not legal immigrants to the United States to try to understand how did that affect their willingness to interact with a digital government representative. We spoke with a number of New Yorkers who were socially isolated and or had no home access at all to a digital device. Again, trying to understand, like, does the 80-year-old woman who speaks only Russian and lives by herself in an apartment in Brighton Beach, to what degree does she have access to the internet in any form at any point in her life? And it turns out actually she goes to the library, and then sometimes she gets on the internet. So, like those kinds of understandings about how digital services could still reach people. I'd used that to actually create a digital playbook for the city of New York, which is publicly available. You can look at it on your phone. I think it's at playbook.nyc.gov, something like that. If you just do NYC Digital Playbook, you'll find it. And that has both a series of kind of high-level principles for how the city of New York wants to think about making services available digitally, and then a set of specific strategies for the city to use, like, for example, designing for mobile first. I mean, this seems pretty obvious at this point, but it's not necessarily something that city agencies have always done. And then finally, a series of very specific tactics for how particular, like literally a city staff member might think about integrating some of these approaches into the work that they're developing. So those were two projects that were very specifically on the kind of policy-making level. We've also done work where we're working sort of deeper inside of an operational unit of an agency, helping them think about how they do better service delivery. So this was actually a project with the New York City Department of Education, looking at the delivery of transportation services to students with disabilities. So just a few things about scale. When you're thinking about New York City's public schools. So New York City's public schools serve 1.1 million children. There's a budget for the City of New York schools that's about $23 billion a year. And that is not capital expenditures. So that's not like building new schools. That's expense on the expense side. That's teachers, that's all kinds of other stuff, all the kind of delivery of services in the schools. So of that, about 100, it's been a long time since I've done this project, I'm forgetting the numbers. It's about 125,000 kids are eligible to receive busing services, because in the city of New York, you don't just get to ride to school in a school bus. It's New York City. The city expects you to walk or take the subway or whatever. You only have access to a school bus if you live more than a mile or a mile and a half from your school where you're enrolled. And that's about, of that 125,000 or so kids, that's about 2/3 of that population. But then there's a population of kids, about 45,000 or so, who have access to busing services because of a behavioral or a physical disability. So it might be, for example, that you're a child who uses a wheelchair. And as you can imagine, it's going to be difficult to take the subway to school. So the city of New York will actually have a school bus come to your home, pick you up from your house, and drive you to your school. So that transportation services for that 45,000 or so kids costs about $1 billion a year. That's a lot of money. And the service is generally understood to be, let's say, not ideal. Kids spend sometimes 2 or 3 hours each way on the bus. Sometimes there are children as young as 5 or 6 who are spending, say, 4 hours a day on a school bus. And they're on a school bus not with a whole bunch of other 5-year-olds. They're on a school bus with like big kids. And sometimes you have kids who have physical disabilities riding around on buses with kids who also have really serious behavioral challenges and who may become violent while they're on the bus. So there are incidences of physical violence on the school buses. It's altogether a pretty challenging service delivery environment. So the question posed to us was, what can you do to make that a better service when you can't change anything about the budget, you can't change anything about the legislation, and you can't change anything about the union rules that control all of the behavior of the people who drive and own the buses? Because the buses, of course, are not owned by the city. The buses are owned by private independent contractors who contract with the city. So our focus became on what we thought was the person who actually had the most at stake, which was the family itself. And specifically because you're dealing with not just children, but children with often profound disabilities with their parents. Because their parents were really the ones who were the sort of most engaged advocates for the well-being of their child. It's not that the other players in the system, of whom there were many, the driver of the bus, the attendant on the bus, the folks at the school district who are trying to provide good services to kids with disabilities, the folks at the pupil transportation department who are trying to run a good busing service, the folks at the Department of Health who are the ones who are assessing children's need for the service in the first place, all of those people care and want there to be a good service for these kids. But really in the end, it's the family members, it's the parents of those children who are profoundly engaged in an active advocacy for their children every day and trying to make sure that they receive a good service. So the tools that we ended up designing here were actually not tools for the system. They weren't tools about policy. They were literally tools about how do parents more effectively understand and advocate for their children's needs in the context of getting this service. So one of them was something incredibly simple. It was a 1-page discussion guide to help prompt parents and social workers to ask each other the right questions about transportation service at the point that the service was being commissioned. A lot of times, parents don't understand that when they sign up for busing service, what they're basically signing up for is their kids spending hours and hours a day on a bus. So one of the questions was, how long will my child likely be on the bus? That's not a question that anybody was being prompted to ask in the decision-making process. So really just trying to help people understand what they were getting into, and doing that in a really lo-fi way, a piece of paper that had a checklist of questions on it so that a social worker and a parent could have a good conversation, a substantive conversation around what busing was going to mean for their kid. Another thing we designed was an information card that allowed parents to say some stuff about their child to the bus driver and the bus attendant. There was no place in this system, there was no designed moment when the parents and the bus staff ever were supposed to speak to each other. You were literally supposed to take your severely disabled child and hand them off to some strangers who would drive away in a bus with your kid. And there was no point at which you would say, oh, by the way, actually, she's really sensitive to sound. So if like there's a big siren, she's going to freak out, you know, or any of these things that you would know as a parent, but which the bus team has no way of knowing. So the idea of creating a little kind of information card that could live on, you know, with the driver, with the bus team to know, oh, here's some things that a parent wants me to know about their child so that I can provide a good level of service. So sometimes it's really, you know, I'm trying to give you this example because it's like you can be way up here on the heady level of the policy making, or you can really think about what are the ground level interventions that are going to make a change in somebody's life. Another project in some ways quite similar to that is something we've just finished doing also with the Department of Education, although a different group, looking at benefits access. There's a series of schools, a group of schools in New York City called community schools, and those are schools which have the highest need, highest poverty child populations. And the idea with the community school is that there will be a kind of pushing in of additional social service into those schools. So the schools become not just a place where kids go to get an education, but also there might be a health clinic on site where a kid could go and get their immunizations or their flu shot. Or even things like some community schools will, for example, set up a laundromat in the school basement. Because it turns out that one of the reasons why kids don't go to school sometimes is they don't have clean clothes. And so they don't want to go to school wearing dirty clothes, or their parents, you know, don't want them to go to school wearing dirty clothes. So if you can create, and they don't have the money to go and do the load of laundry, so if you can make a free place for the family to come and wash their clothes, then the child's absentee rate will go down, for example. So there's lots of different ways that the community schools will provide these kind of additional sort of supports, always around the focus of reducing absenteeism and increasing educational outcomes. So one thing that we started looking at with DOE was there is a known population of New York residents who are eligible for various public benefits like food stamps, but who are not receiving them. So is there a way to use the trusted environment of the community school as a place where parents could actually sign up for public benefits that they're eligible for but they don't currently receive? So we did, this was actually a really fascinating project around designing behavior change. This wasn't a heavy kind of artifact-y project. It was literally about how do you activate people to do new behaviors with one another? How do you activate school staff who are already in communication with parents to reach out to parents and say, hey, by the way, did you know that you might actually be eligible for food stamps? Or even further, did you know that 90% of the other families in the school are receiving food stamps and you could get them too? And then to say, oh, we have a benefits counselor who's coming. She's going to be here every Thursday at pickup time. Do you want to make an appointment with her? You know, and then how does that benefit counselor then form a relationship with the parent in the context of the school where it's easy and convenient and safe feeling for them to go? A lot of parents who the supposition was that one of the reasons why parents are not accessing these benefits is because they're concerned about their legal status and they don't want to actually go and interact with government agencies. So the sense that you could actually provide access to these services in the context of a school which feels like a safe space was a question we wanted to test. Would people actually feel like it was safe? Would they trust that the school environment was a safe place for them to share that information? So we've done a first stage pilot on this and had pretty good results. We got 17% of our referrals to get into the pipeline to receive benefits, which is a really high rate of follow-through in terms of typical sort of social service referral. So this is a project which hopefully will go into a phase 2 piloting with a much broader range of schools next year. Veteran mental health, we also work with the federal government. So this was a project with the VA. The VA is deeply committed to providing high quality services to all 21 million veterans. And although the VA certainly has a reputation for not being a particularly customer focused agency, I have to say my own experience working with folks at the agency is that I see a huge commitment to trying to do well by veterans. So much so that there's actually now a design and insight group in VA headquarters, which is focused specifically on understanding veteran experience. And that was a team that we helped in the initial year of sort of standing up that office at that agency. This was actually a separate, earlier project with VA, with the VA Center for Innovation, looking at the question of what happens when a veteran essentially reaches the point where they recognize that they have a mental health need. What happens next? What happens when you get to the place where you're like, okay, I'm going to seek some care? What barriers do veterans experience when they actually go to try to get someone to help them with whatever their mental health issue is? And that led to a series of both very specific short-term recommendations, like this form, which everybody has to fill out in order to get PTSD-related services, asks people to describe the circumstances in which they saw their buddies killed or maimed. That is, as you might imagine, triggering for people. So you need to redesign the form so it doesn't ask for that information, or at least it doesn't ask for that information in that way. So those kind of super micro recommendations up to much higher level recommendations around how might a VA medical center design physical spaces for people who are dealing with traumatic brain injury. How do you make a space feel navigable and reassuring as opposed to overwhelming? And that recommendation was literally not that we had the solution for that in the scope of our work, but we rather said, as an agency and as the operator of all of these VA medical facilities, you should have a set of design standards which speak to how your physical facilities serve the needs or don't serve the needs of people who are dealing with mental illness. We've similarly done some work with VA specifically around the VHA health enrollment process, looking again at like what causes veterans to enroll through different channels. So right now, 70% of all veterans who are signing up for VA healthcare do so at a physical facility, not online, not over the phone. So the VA actually had a question, which is, why is that? Why are people walking into our hospitals to enroll as opposed to going and enrolling online? So this is actually the team in Topeka, Kansas, I think. So when you are a design researcher, you get to go to exotic locations like Topeka, Kansas. So that's just something to keep in mind. And just trying to understand what the kind of user requirements were around enrollment. And it's just one of those things where when you often find that, and this is not going to surprise anybody here, but it comes up again and again, that when people are specialists and focused on a certain thing, a certain area of policy, a certain area of service delivery, their focus is narrowed in on that. Like, so when you are thinking, when your job is to think about VA enrollment all the time, you think, well, why would anyone want to enroll? Why would they want to go through the hassle of walking into the hospital when they could enroll online? Enrolling online would be so much easier and faster. But the answer is, people aren't going to the hospital just to enroll. They're going to like check out the whole scene. Would I want to come here for my health care? Does this seem like a nice place? How long did it take me to drive here from my house? Was the drive bad? Are they nice to me? Does it smell okay here? You know, like people are going to like, and again, this comes back to the biological. People are going to have the physical experience to do a little dry run almost of what it would be like if they were going to get their service there. So it's not just about enrollment per se. It's about what would it mean for me if I received my health care from this entity. So there was a way in which we came back to our partners and said, you know, this is a measure of people's interest and engagement in you. They want to come and see you and see what you are. So how do you take advantage of that? How do you actually make that time when they come to enroll actually a kind of welcome to the VA? Let us tell you about what we can do for you here. So sometimes you can find some nice stuff like that. It's not unexpected. So I think this is my last one here. So in some ways, we're able to see its ripple effects the most. So one thing I'll say about this is that you don't actually have any idea what you're designing when you deliver it. you don't actually know what you've designed until years have passed. And you've seen how it has spread and changed and altered a set of behaviors and policies and service delivery contexts. So here, we worked with the New York City Department of Housing Preservation and Development, which is the city's affordable housing agency, to think about how to make what's called the housing lottery, which is the mechanism by which people apply for subsidized housing units. How do we make it clearer to people essentially what they were doing when they entered the lottery? It wasn't that you were going to put your name in a hat and then somebody's going to pull your name out and give you an apartment. Like if you win the lottery, what you are winning is the opportunity to be screened to see if you are actually eligible for an affordable unit. So people would apply, but not really realize that the rules about what their income was, about what their household size was, that was critical. So people, many thousands of people were applying for units for which they were never eligible. And the city didn't want that. The city didn't want people having the sort of almost like the disappointment of not receiving a thing that they were never eligible to receive in the first place. The city actually wanted to encourage people who were eligible to apply, or to get people to understand how they could determine whether they were eligible for a thing so that they could apply for it. So we helped them by developing a suite of communications materials that better explained the affordable housing application process, going, both from like a very simple overview to a kind of more detailed income eligibility guide. But then kind of most critically, we understood that it wasn't enough to just design this suite of new communications materials. You actually had to get it to people in their everyday life. So we helped them also design a set of new sort of strategic interactions with different proxy organizations. How does the agency leverage its relationship with housing developers to get housing developers to speak more clearly to the public about how to apply for affordable housing? How does the city develop stronger relationships with community-based organizations so that those community-based organizations who actually have meaningful relationships with people in their neighborhoods, who speak those neighborhood languages, who come from those neighborhood ethnic and religious groups, how does the city actually form those relationships so that those community organizations can be ambassadors for the availability of affordable housing? So that program actually was called the Housing Ambassadors Program. And it launched with 3 or 4 community organizations as pilots. And the idea was that the city would kind of push out information and training to these couple of community-based organizations, and they would get a bit of a sort of an official seal, like, I'm an official housing ambassador, members of the community, you can come to us and get sort of good and reliable information. But part of that was also that the community-based organizations would have regular phone calls with the agency and tell them what was happening on the ground when people attempted to apply, and give them feedback about people's lived experience of trying to get affordable housing, because the city actually had no mechanism to hear from New Yorkers. So that is what has been fascinating about this. Now it's 3-4 years on, there's like 20 or 30 housing ambassador organizations across the city, and the city is beginning to alter housing policy because of what they're hearing in that feedback loop from the housing ambassadors. The housing ambassadors are saying to them, for example, people who should be getting affordable housing are not getting it because they can't pass a credit check. And so the city altered or maybe even abolished the credit check requirement. The city is actually now making policy decisions based on a designed feedback loop. So that's where there was no way that we as the designers knew that that would be the outcome. We couldn't design the outcome. We could only design the channel that could lead to that outcome.